Now, the NHS is to offer more help to people living with diabetes after a study found the disease was linked to a third of coronavirus deaths in English hospitals. There'll be video consultations with medics and a new helpline and weight loss programmes after clinicians found that higher blood sugar levels and obesity increase the risk of dying from Covid-19. Our health correspondent Dominic Hughes reports.
Living with diabetes is hard at the best of times. But for Janet Carroll, who has type 2 diabetes, coping with the fear of Covid-19 is adding an extra level of stress.
Not sleeping on the night, restless, and just dare not go out. And it's like being in a Stephen King novel at the moment. It's frightening. It really, really is.
Janet's concerns are reflected in a new study indicating diabetics are at increased risk of death from Covid-19. This applies to type 1, which most often develops in childhood, and type 2, which affects mostly older people and is associated with weight gain, a poor diet and a lack of exercise. But while high blood sugar levels and obesity add to the risk, age is far and away the biggest risk factor. Older people are more likely to die of the infection.
Age is the dominant factor here. So actually, people with either type 1 or type 2 diabetes below the age of 40 are at very low risk. And over the period of time that we studied, we didn't see any recorded deaths in people with type 1 diabetes or indeed type 2 diabetes below the age of 20.
The charity Diabetes UK says that as we begin to cautiously resume our lives, people living with the condition want to know how they can protect themselves.
As lockdown eases, more people moving back to work, it's important that government looks at this data and continues to use this evidence to drive its guidance and to drive its policies around how people with diabetes can stay safe, whether that's at work or whether that's at home. And equally, what's important is that people continue to get all the advice and support they need.
The NHS in England is encouraging diabetics to stay on top of their condition, using video consultations with medics, a new NHS helpline and weight loss programmes. Meanwhile, medical experts are looking at whether the risks for those who have diabetes are so great they should consider shielding themselves like other vulnerable groups. But the isolation that would cause could lead to more harm than good. Dominic Hughes, BBC News.